Welcome back to the American College of Surgeons Bulletin Brief from the front lines, Surgeons' Voices. With me today is my friend, Professor Julio Mayol from Madrid. And in addition to being an internationally acclaimed digestive disease surgeon, including colorectal surgery, Julio is the leader, bar none, for surgical tweeting. Welcome, Julio.
Hi, my pleasure.
I always learn from you, learning from the maestro, the master, about the power of Twitter. You've indeed started many campaigns on Twitter, the SoMe for Surgery and many others, but not everybody who's listening and watching today is necessarily engaged in Twitter. Hopefully after listening to you, they will be. So perhaps you could start out just talking a little bit about why surgeons should be active on Twitter.
So thank you very much for inviting me. It's important that we need to understand how surgeons interact, and we need to make collaboration possible. And social media has allowed us to do that, and even more so with Twitter. Probably we don't pay much attention to the social aspects of surgery, but surgery is all about a social collaboration, social interactions, teams, knowledge, and information are key if we want to practice better surgery. Twitter allow us to share information and to overcome barriers such as distance, geographical distance, cultural differences, time differences, and also language and time. So there are many different barriers that Twitter can help us overcome when we want to reach farther with our information.
When did you become involved with Twitter?
Oh, it was back in 2009. In fact, I started my account because I wanted to follow my mentor, Jeff Matthews. He was in Chicago, I was in Madrid, and the only way to stay connected with him, almost real time, was through Twitter. So that's why I felt the urge to start my account. And then something that was new and it was difficult to predict what the outcome would be has become a massive tool for knowledge sharing.
Absolutely the case. And you have a certain advantage over both Jeff and me in terms of tweeting in two languages, tweeting in English and in Spanish, which of course increases your engagement with people. And you mentioned Twitter overcomes language barriers. Can you give us a little bit of a snapshot about the use of Twitter in different countries around the world relative to English, Spanish, and other languages?
Well, Twitter is very popular in Europe, Italy, the United Kingdom, Spain, not so much in Germany and in France, but also for Sweden, Norway, or Denmark, it becomes very popular. We have many languages in Europe, and it's difficult if we don't share the same language to stay connected with others. And now we can do it because first we use English, but secondly, we can use the translation app on Twitter. So we can get a better understanding. It also brings some risks, of course, because we can get lost in translation. Sometimes when English is not your first language, you can make mistakes. Even myself, I can make mistakes and I can be misinterpreted by native English speakers. So we must be careful. We must pay attention to that. But we can speak with Middle East surgeons in Africa, in Latin America, not only Spanish speaking or native English speakers, also others who can share some information, meaningful information, using probably English as this common language, understanding the limitations of different cultures.
Interesting point. How about in Asia? What's the use of Twitter in China, Japan, Korea, elsewhere?
Japan and Korea are not so active, but India is becoming a huge contributor to Twitter. They're becoming more and more engaged, although they are more interested in the past in Facebook and LinkedIn. We need to use also those two channels to communicate with other surgeons. But Twitter is becoming more active. Middle East is also very active. Saudi Arabia, Kuwait, those are also countries where surgeons are in need of connecting and collaborating with us. And that's the beauty of Twitter. As a group, we are more powerful than we are as individuals.
So how does one get started? Let's say somebody is listening to your comments today, watching this video. How does one begin on Twitter?
First of all, just start an account. It's quite easy. There is this guideline. It was published in the bulletin of the American College of Surgeons, and you can follow it. But basically, you open an account and start following people you trust, people you have met face to face, because you trust them. Trust is essential for digital communication. So first of all, connect with those you trust, you already trust. Key opinion leaders, institutions, surgical journals, and you start just follow them, and to interact with those you already know. Next, they're posting some information, probably very basic stuff like links to papers or comments to papers, and try to engage in conversations with people you know. Then it's easy for them to understand what you mean when you tweet something. Sometimes just using 140 or 280 characters may be hard when you are not trained to communicate on social media, but that is very safe. Once you know how to do that, you can start creating your own content, which is something of very meaningful interaction. Not only info mediation, just sharing, editing, or curating content, but also produce your own content. And if you reach that point, then you are safe. Try to avoid, if you are not used to this platform, try to avoid like hot topics with a lot of controversies around them. Try to avoid going into hot debates, because Twitter may not be the right tool to have a meaningful and deep conversation around a controversial issue.
That's good advice. So avoid controversial issues, at least at first. What are some other things that should be avoided, or some of the potential pitfalls which people need to recognize so that they can avoid those pitfalls?
So first of all, sometimes you just feel the urge to respond to anything that you see, and it may hurt you. Try to avoid that. Think twice. Let it cool down, and then reflect on it. Because sometimes we try to do just as we said, and that's not a very good thing to do. So first of all, let it cool down. Secondly, don't say anything that you wouldn't tell your mom. That's a good rule of thumb. Don't go into risky areas. Third, politics, religion. If you are a surgeon and you are exposed to patients and to people who are not healthcare professionals, not even surgeons, try to avoid those. because it's going to be very difficult for them to understand the deep meaning of what you are sharing with them. Don't forget that what you say on Twitter may be seen or heard by people you don't know, and they don't know you, and they don't know how to contextualize your words. So be careful. Think twice. When you're in doubt, don't tweet it. If you think it's risky, just wait. Sleep on it, and you will see it with a clearer vision the following day.
Very sound advice, very sage advice. Now, you spoke about thinking twice and things not to tweet about. What about things you'd like to be engaged in a conversation, things about which you'd like to tweet? How does one find subject matter? For example, for you and I, colorectal surgery, how does one discover like-minded people?
That's something very interesting. Try to look for hashtags, something that this is a tag that allows to search Twitter, trying to find people who share the same ideas, the same interests that you have, and also connect with them. Start following those people. Once you have reached that point, look what they share and try to share your opinion with them. Try to engage with them. People are frequently very open about their interest on Twitter, and they try to bond people around their fields of interest. So try to find those who can be your Twitter mentors and ask them for advice. I think that's a mentor, like offline, in the offline world, a mentor is a very positive figure on Twitter. And there are many out there. For example, follow colorectal surgery if you're interested, hashtag colorectal surgery if you're interested in colorectal. But there are others like hashtag so me for HPV, so me for endocrine, so me for peritoneum, or MedTwitter, hashtag MedTwitter. You will find people, very interested people you haven't heard about, who can teach you, who can show you how to use Twitter in an effective manner.
Interesting information. And you've spoken about connecting with people. You spoke about your mentor and meeting other people and reaching out to key opinion leaders. So could you give us an idea of the magnitude of the reach that one can get? For example, when we have the Clinical Congress, the American College of Surgeons, and we have ACS CC 21, whatever a hashtag is going to be this coming year, or we recently had the DEI, the ACSX DEI initiative hashtag. What's the magnitude of reach if one participates in these conversations? Well,
this is a fundamental change. We were used to connect with, among us, surgeons with surgeons, some researchers, some surgical researchers also connected with us. And that was in the range of the thousands. On Twitter, we can reach millions of accounts. And not only those who are directly interested in surgery. There are others who are listening. There's a huge audience out there, probably 40, 50 million. ACS 2020, it was around 50 million accounts that saw content published by people who attended ACS CC 2020. So it is fundamental change. And even more important than that is that people who have diseases, patients, are listening, are paying attention, and they can teach us a lot. They can show us a different perspective, and we can improve what we do by listening to them. This was something that never occurred before. And now we can listen to them. We can have conversations with them. listen to their experiences. That's a fundamental change, and it's going to transform how we practice surgery. This is going to transform how we practice medicine. We will become really a value-based system, experience and outcomes that matter to patients.
Yeah, excellent point about the patient-reported outcomes and engaging in patient conversation. But as one engages in conversation with patients, and even if one is inadvertently and unknowingly doing so, because Twitter is a public platform, and if you have an open account, people can see what you have to say. There are some cautions that go along with communicating with patients.
Yeah. First, we must be aware of that. We must protect patients. We must protect their information. HIPAA regulation, GDPR in Europe. We need to be aware of that, and we need to be aware of our own brands as surgeons. We cannot say things. We cannot complain continuously about this patient who showed up in our offices and did this and this, because it's not fair. We are not just speaking among us. We are speaking for the world when we are on social media. And it's disrespectful. And we should be aware of that. And we should avoid to share these gross images that may hurt people who are not ready to see something they were not looking for. And sometimes we reveal information, although we are not aware, information that can be identified, that can suggest who was the person who had that procedure, who underwent that operation. We must be aware of that. We must be very concerned about protecting our patients and the surgeon-patient relationship.
And then the one other thing that I might add is the temptation one might have to respond to a patient asking a direct question in terms of giving medical advice. You mentioned HIPAA and you mentioned the DPR, you mentioned the importance of protecting confidentiality, but what about offering advice? Somebody tries to solicit it from you and says, you know, Professor Mayol, I have this issue. How does one respond?
Yeah, this happens rather frequently, I would say. And it is not a good practice to respond to this. I don't give advice, clinical advice on Twitter. I just let them know that this is not the right channel to do that. If they have this issue, they can contact me or someone else here or there. I can give them contact information to reach the right provider, but I don't engage in clinical counseling or anything related to healthcare issues on social media. It is not good practice. It is risky.
Well, thank you very much. You shared a wealth of information with everyone. I hope that people who are already actively engaged in Twitter are following you, and that they'll learn from you every day, as I do. And those individuals who are listening and watching what we've had to say today, who are not involved, I hope that you all get engaged, because it's a great way to have a global conversation. I appreciate your time, Julio. Any last thoughts you might have for us before we close?
Well, we need surgeons, and the American College of Surgeons is key for this. We need to understand how our social interactions shape surgical practice, and we need to pay more attention to the social aspects of our practice.
Thanks once again, and it's great chatting with you as always. I can't wait till it's in person again someday.
Sure. Stay safe.
You too.